You can start, Zaveria.
Okay, ma'am. First of all, a very good afternoon to everyone and happy Teachers Day. My topic is poster presentation on technology for stroke and pain management. First of all, I would like to give a brief introduction about stroke and its cause. What is a stroke? Stroke, it is a serious and life-threatening condition which occurs when the brain blood supply is cut off. What are the causes? The main three causes are ischemia, hemorrhagic, and transient ischemic attack. First is ischemia. Ischemic it means when there is a lack of or deficiency of oxygen to the area of brain when there is a cut of blood vessels to that area lead to stroke. Second is hemorrhagic. Hemorrhagic occur when there is excessive loss of blood from that area due to any sudden trauma or any road traffic accident. The next is transient ischemic attack. It can also occur with several causes, but it is temporary for 24 hours. The patient may recover. Then I will go for the technologies which are used for the management part. First is cone beam imaging. The cone beam imaging mainly used for detection whether it is ischemic type or hemorrhagic type. Second is seborrheic stroke detecting visor. It is also a kind of detection purpose for whether it is ischemic or hemorrhagic, but mainly it is used for the large vessels, and also it take very few seconds and involve a low energy radio wave for detection purpose. Next is vivitism nerve stimulation treatment. Vivitism nerve stimulation treatment, it get paired with the motor movement during the rehabilitation, which help in the motor functioning and also for the learning and memories purpose. Then next is Sereno technology for the stroke and pain management with the aneurysm device. It is a kind of device which help in diverting the blood vessels from the aneurysm part so that it can prevent the risk or reoccurrence of the stroke. Next is video game. It play a very important role in rehabilitation as it help in the survivor patient to get exercises of the brain as well as the body. The next is all the virtual reality. It is also a very important for the rehabilitation purpose as it help in it provide a environment, safe environment, a virtual type environment for the patient for practicing and exercising a daily daily activities so that a patient exercise regularly and it prevent the reoccurrence of the stroke. Then next is Alter G anti-gravity treadmill. Okay, this is a treadmill type. It is used with mainly for the lower limb if there is any paralysis or weakness in stroke patient. So it what it does is it uplift the patient body and a fraction of patient body is involved and which help the patient to walk, run, sit to stand. Same is for the zero gait and balance system also. As in this also it provide a dynamic support to the body and it's also helpful for the patient to walk, run, sit to stand and all the movement which can be performed with the lower limbs. Then there is esco. Esco is also it is a type of suit which is applicable for the patient and it is mainly used for the patient for the weakness as well as the paralysis of the lower limb. The next is Apple iPad. Apple iPad is used for the communication and organizing applications for the patient. For the communication mainly it is used for. It is also a kind of device. Then there is a functional electrical stimulation. It is also known as FES. And this main purpose for the FES is that it stimulates the peripheral nerve along with the motor contraction and it also helps in the functional movement of the body. Then next is there is the next is dragon dictation. The dragon dictation, it is a device which is used for the patient itself so that the language, the speech which is used by the therapist should be slowed down so that patient is able to understand the language and easily flexible for the patient to dictate it. Then next is walking aids. Walking aids is used for mainly prevent the foot drop. Foot drop, how it prevent? It prevent by stimulating the particular nerve, so particular muscles of that area, so that it can help in the liftment of the foot, so that it can prevent the foot drop. The next is sibomas. Sibomas is mainly used for the upper limb, as it is a dynamic arm supporter for mainly shoulder and elbow joint and help in the movement of the upper limb. The next is Bioness LS300. It is mainly used for the prevention, or we can say it is used mainly for the knee joint and ankle joint limitation and help in the movement of the knee joint and ankle joint and prevent it for the hyperextension or any abnormal movement. The next is wireless therapy. It is also same as that of it, and but its main function is that it work along with the fast, as it has been stimulation, so it will work as associated with it. Then second is environmental control technology. In this kind, the patient also uses a device which help it for the movement of for grasping anything, for movement of the hand or any type of any environmental base for the helpful or the activity of daily living. Then next is spasticity management using a we can treat it by the baclofen pump. It is used for the treatment of the spasticity. Then light gate, it is a kind of it is used for like a gate cane or something like the harassment is used so for that the patient for clearing the gate and also for the gate purpose mainly. Then there is a certain we will move to the pain management, like there are certain pain management for the stroke purpose. There is first a SIBO stretch. SIBO stretch, it is also a dynamic it is a dynamic splint which is used for the to reduce the pain and also to reduce the pressure of the joint and help in the movement of the joint. Then second is desensitization. Desensitization, it reduce sensation by any response or outer response to the body and help in the reduction of the pain. Then third is contrast mark. Contrast mark means alternate immersion of that area, the pain area, to hot and cold water that may be in the ratio 3:1. It also help in pain reduction. The massage is another type of pain management. It may use the Swadeshi and the deep tissue, then trigger point and certain other massages which can help in pain management. Then electrical modality we can use like TENS, then IFT, then ultrasound. This all are helpful in pain management. Behind this, the pathology is that it helps in circulation. It increases the circulation of that area and help in and also provide oxygen to that area, so that it can help in reduction of the pain management. That's it, ma'am. Thank you.
Okay, nice, Zaveria. Any questions, Dr. Vaishali and sorry, Dr. Pallavi and Nidhi?
Zaveria, Fatima, I have a question for you.
Yes, ma'am.
Can you please explain what are the barriers of functional electrical stimulation?
Sorry, ma'am. I'm unable to get your question.
What are the barriers or limitations of functional electrical stimulation? In stroke management, what are the barriers or what are the limitations?
Actually, you are asking the barriers of functional electrical stimulation.
Yes.
Can you tell me in what stage the pain is there in case of stroke? In what
Ma'am,
stage of stroke pain occurs?
ma'am, it occurs from mainly the end of the second and third stage of the stroke.
What is the second and third stage of stroke?
Ma'am, first stage is the complete paralysis. Then second is the there is spastic when there is a spastic regenerate, that time is it goes to the pain start.
Okay. Okay. Thank you. Thank you from my side, ma'am. You can continue.
Okay. Thank you, Dr. Nidhi and Dr. Pallavi.